Well, with me right now is Dr. Shankle, and I'm going to go through his full title because it's a long one. He is the director of the Memory and Cognitive Care Disorders Program, Pickup Family Neurosciences Institute at Hoag, Judy and Richard Voltaire Chair in Memory and Cognitive Disorders, right? Does that fit on your card?
Pretty good. Pretty good.
Nice to meet you, sir. Obviously, what we're talking about here today is dementia, and there's different forms of that. So let's talk about that first. Years ago, we used the word senile, but of course now while we still use that, we call it Alzheimer's, but there's other parts to that as well, right?
Yes. Alzheimer's is one cause of dementia. Many people confuse dementia and Alzheimer's.
Right.
Dementia is more like a severity, like mild, moderate, severe.
Okay.
And there are milder forms, one's called mild cognitive impairment. That's when there's just a memory problem that is interfering with a person's ability to remember a conversation or remember to follow up on something they committed to, or starts maybe repeating questions that they had just asked. That's a milder stage.
Okay.
Dementia is really a stage where people lose the ability to perform well-learned skills that they've done all their life, like cooking or paying bills.
Okay.
That's a very severe stage in terms of the amount of brain disease. And dementia can be caused by Alzheimer's, about 45% of people.
Okay.
And another 45% have what's called vascular disease, which is basically blood flow to the brain.
Okay.
And that can cause either little strokes or areas of reduced blood flow where the brain doesn't function as well. And it turns out that almost all chronic medical conditions can lead to vascular disease. Plus, there are risk factors for Alzheimer's disease.
Right.
So the people who are at greatest risk for developing a dementia, whether it's vascular or Alzheimer's, which is about equal, are people who have had a head injury, people who have multiple chronic medical conditions that aren't well managed, people who don't exercise, people who have a genetic predisposition. About 1 out of every 4 people over 50 have a special gene that triples the risk for Alzheimer's disease. And so it is a condition that affects about 1 out of every 4 people over 65, and about 1 out of every 2 people over 85. And we now know it is preventable.
Okay. Let me ask you, if we could just step back for a minute, back to the cognitive part. And the reason I want to ask you about that is I think we all, as we get a little bit older, forget certain things. And I think even more so now, simply because, as we were talking beforehand, about devices and all, you got so much information overload coming in compared to 20 years ago, certainly the generation before us, that your head spins sometimes and you do forget things. I know I better have a list on my phone when I go to the grocery store because I'll forget.
Yes.
But that's different than somebody who, for instance, 10 minutes from now or in the middle of the day from now, I would walk around going, I don't remember what we talked about with that doctor today. Am I correct?
Yes. In fact, there's a stage of normal aging in which people notice a decline in their memory.
Okay.
That has been well studied. It's known to occur, started about 45 years old. However, people can compensate for greater memory difficulty with their devices or some reminder system. So many normal aging people do have memory problems, but they can compensate.
Right.
Okay, and that also happens to be a stage that people pass through to become demented. And so if you identify people who have some disease in their brain, okay, while they're still functioning normally, you can then treat that condition, and in most cases you can stop it.
Okay.
So people can remain functionally normal even though they have Alzheimer's disease.
Okay.
Or they can remain functionally normal even though they have vascular disease. And we had a recent patient of mine who basically followed the advice of a population health program for memory loss, has been followed for about 11 years now, was detected to have Alzheimer's about 6 years ago while they were still completely normal, and put on treatment. And for the last 6 years, they've had complete reversal of their cognitive impairment, even though they have Alzheimer's disease.
Now, I've heard that some of the, if you catch it in time, and that's the key, of some of the things that can help alleviate Alzheimer's is one of the big things, of course, is your diet, like so many other different things, right?
Yes, I mean, there are, we know epidemiological studies show that olive oil, fish consumption during the week, refined sugar, less than 50 grams a day, the Mediterranean style diet with low intake of red meat and organ fat and dairy fat. Those are all things that reduce risk of developing Alzheimer's. And one can look at all sorts of risks. But the biggest factor of all in preventing dementia is the annual memory checkup.
Right.
The annual memory checkup allows us at a population level to be able to give a simple memory test that's 97% accurate at separating normal aging from having a memory loss that's affecting function. And when we can do that, we can then diagnose the problem, treat it, and in most cases, those individuals will remain at a level where they never become demented, even if it's Alzheimer's disease.
Yeah.
And what we've seen is that just from better awareness about diet, exercise, lifestyle, that the prevalence of dementia, at least in the United Kingdom and one other country where it's been studied, that prevalence is reduced by 25% over the last decade. So the real key here is the ability to have a tool that's very simple, that takes about 10 minutes, and check memory and say, this is a normal aging process, or this is not a normal aging process. Diagnose it in treatment while you're normal, so that people either remain normal or progress much more slowly if it's Alzheimer's disease and never become demented. And we now are routinely seeing people like that.
What age would you suggest that someone comes in, as we know with other different diseases and things, different kinds of cancers, breast cancer and all, there's usually a certain age, okay, now it's time to come in and get your annual checkups.
Certainly. Well, if a person has a family member with some form of memory loss, okay, I think it makes sense to start at 50 years old.
Oh, okay.
If there's no history of somebody in the family, no history of traumatic brain injury, and no chronic medical conditions that aren't well managed, then I think about 60 years old. And this is because the actual molecules that cause Alzheimer's, the first one is called beta amyloid, and it starts to accumulate 40 to 50 years before the first symptom.
Wow.
And we now have the capability of giving a memory test and detecting the presence of amyloid or some other disease before there are any symptoms.
Right.
So this is much like a fasting blood sugar or a fasting cholesterol test.
Okay.
We simply don't wait for a person to start having kidney failure before we treat diabetes. And we don't wait for a person to have a stroke before we treat their cholesterol, okay? Well, that's obvious to most people, but it's not obvious to check your memory annually. And that's, I was on the international committee to develop a roadmap to prevent Alzheimer's by 2025. And after that meeting, I came back to Orange County, wrote a grant to start the Orange County Vital Brain Aging Program in 2010. And it allows the community in Orange County to have a very quick way of checking their memory with 97% accuracy so that they can treat this problem and remain normal.
As far as treatment goes, we've talked about diet. What other things? Exercise, that sort of thing. But is there a medication, a vaccine?
So with Alzheimer's in specific, there are several treatments that have been shown to delay the progression by 30 to 60%. It's the combination of one medication called memantine, or the brand name being Namenda, and another group of medications called cholinesterase inhibitors. And that's why I went to medical school, so I can pronounce those things. But those cholinesterase inhibitors, there are three basic ones, Aricept, galantamine, and ribostigmine. And when you combine the memantine, which partially blocks tangle formation of Alzheimer's, and you give one of the cholinesterase inhibitors, preferably ribostigmine or galantamine, because they continue to work, whereas Aricept or donepezil stop working after about 12 months, based on the current studies, then that combination reduces the formation of the amyloid, reduces the formation of the neurofibrillary tangles, which really cause the cognitive impairment, such that Dr. Attree at Harvard showed that treatment at every stage of impairment delays progression by 33 to 60%.
Wow.
Now, if you combine that with physical exercise, mentally stimulating activity, reasonable diets, then what recent studies from Mia Kivi-Pelto in Finland have shown is that not only do you see improvement in cognition over 2 years, but it reduces the likelihood of decline by 30%, just with these behavioral approaches. And what I've seen is that when people combine the medication and the behavioral approach, what you typically see in Alzheimer's is a 50 to 200% delay in the progression.
Wow, that's incredible.
With vascular disease, in most cases, that's another 45% of all people have vascular disease. In most cases, you can stop the progression entirely as long as you manage the underlying risk factors. So this is a different ballgame than our parents dealt with.
Yeah, and I want to give a number here that if people want to schedule a memory assessment, they can. And the number is 949-764-6288. The website is ocbrain.org. And can anybody do this? Do they have to tie in with any kind of insurance or?
No, this is designed as a program for the Orange County population. It is actually subsidized heavily by Hoag Hospital because it is so important. This is the cost of dementia in the United States is $1 trillion.
Right. All right, sir. Dr. Shankle, thank you very much.
You're welcome.
Pleasure to have you on. And again, that phone number, if you would like to get a memory assessment, 949-764-6288. We'll be back.
Thank you.